So for Soleus, we've got our knee flexed because we want to take out gastroc. Now, we take out gastroc with the knee flexed because the muscle attaches above the knee. So again, if you're getting flustered in the prac exam, you're going to get more flustered when I ask you, so why does flexing the knee take out gastroc? Again, cool and calm. And again, if I have a muscle which is here and I'm getting the muscle to act at a 90-degree angle, it can't work. So that's a basic thing. If I have this here, if I have a slight bend to it, the muscle will still work. When I go like this, my muscle is originating here. I can't get a pull at that angle, and that's why bending the knee takes out gastroc. Not only because it's above the knee, but then it takes it out of the equation. So that's the answer that you give me there. My knee is flexed. I'm going to fixate my leg proximal to the ankle again. I'm going to dorsiflex the foot. So again, if I have a weak foot, if I'm talking about that post-stroke or so forth, I'm going to just put my hand on my calcaneus. But again, we know that torque equals force by radius, as we had discussed in the talks the other day. So the further I go, the better I have. I don't want my foot to be excessively inverted or everted. I just want to sort of keep it in a relatively neutral position, but not worrying about subtalar joint neutral as such. And then I'm going to get my patient to plantar flex without inverting or everting. So if I invert or evert, then obviously if I'm everting, I'm going to use my my perineals. If I'm inverting, I'm using tip toes. Or my other flexors could come into it. So I really just want to keep the foot in neutral and just ask my patients to maybe go like that for me, and we put our pressure on. Okay, so we've got that there. So weakness, again, if we have that, we can have a cavus positioning of the foot and inability to rise on toes as well, but it's more tip post than that. We can have anterior displacement of the body, possibly with knee flexion position as well. Again, this is a injury which often occurs when someone has been doing things like deep at the gym, and I've been doing these power lifts and things like that, that can sometimes cause an injury to that soleus muscle. It's not something that you see regularly, but it's just to keep in mind what sort of symptom pattern you're going to see. So gastro